for a particular drug, benzazole, which we use for the side effects of the antipsychotic. Why was this guy abusing it? Because it was making him high, it was giving him euphoria. But all of us noticed, most of the pharmacists will just, because of pattern, why are you coming? And then the guy will say, this is the particular one I want, the one that has described it to us. And we all was wondering, why that particular one? So we are really gatekeepers, we should uphold the ethics of prescription. We are also gatekeepers also by identifying, I would just call it basic symptoms of mental health. We are easily accessible, community pharmacy. Once somebody hears you're a pharmacist, they don't care whether you're practicing in the hospital, whether you're practicing in the industry, they start downloading their problems. And if we are not educated about simple symptoms of mental health, we might run into trouble. We might just be saying things that are not. But if you are able to know that, yes, somebody comes to your pharmacy or somebody's up with you as a pharmacist that, oh, I've not been sleeping for 3 days, I've just noticed I've been irritable, beating my children, doing things that are not right. That should be a point, and then you probe further and the person is saying, oh, for like 2 weeks and all that. So you're able to say, oh yes, this person is coming out with a mental issue, I need to refer, I need to know where to refer that person to. So that's where we come in as gatekeepers, and we should be able to spot out those signs and refer them immediately so it does not degenerate.
Thank you very much. I think she's reinforcing what our keynote talked about, having community screening tools for the pharmacists so that you can identify some of those early warning signs. I'd like to move on to the zonal commander. Madam, could you lend your voice very quickly to this before we take a second round and engage the audience? Thank you.
Good afternoon, distinguished ladies and gentlemen. Drug use problem is a public health issue, a very complex one. And that makes, because it transcends from the individual who uses to the society. So it's a social problem. It doesn't end with that individual. That makes all of us here. Every individual is a stakeholder when it comes to, addressing the issue of substance abuse. Just as she mentioned, and just as we are here, the pharmacists have their very big role to play, because apart from the traditional drugs like cocaine, like heroin, and the rest of them, what we see in the field as NDLE officers is that a whole lot of abuse is going on when it comes to the issue of prescription drugs. And you heard my chairman when he made his remarks talking about the cost of tramadol. Before I came to Lagos, I served the agency in Honest Seaport. And almost on a daily basis, we were intercepting containers loaded with tramadol, 225 milligrams. Of course, as pharmacists or as professionals, health professionals, we do know that the normal threshold of prescription tramadol is 50 to 100. But the ones that come into our shores are 250 milligram, 225 milligram, and they come in container loads on daily basis. As we are intercepting in Apapa, we are intercepting in One, in Tinkan, and all that. So what am I trying to say? Addressing the problem of drug use is our collective responsibility. No single individual, no single agency can actually do justice to that, except we pull our resources together and work as a community and work as a nation, playing our roles in our different areas as law enforcement officials, as professionals, as community members, as parents. That is the only time we can actually make a meaningful impact. Thank you very much.
Thank you very much. So, collaboration has been highlighted. The role of the NDLEA, their mandate is very clear, and we can all attest to the fact that they have been doing justice to that. But it has been said that we all have a responsibility as we move to change the trajectory within the ecosystem. So looking at our theme, and let's look at community and the socio-economic development. So from a human rights perspective, Dr. Koyejo, what would you want to add to that discussion?
Right, thank you, madam. Like I mentioned before, human rights are interdependent. And when we look at the human rights to health, we look at other aspects of our life that are other rights that are interdependent with it, like the right to life. If you don't have a right to good health, your right to life will be meaningless. If you are not living if you don't have good health, you won't be able to have a right to life, and the person may even die eventually if you don't have right to health, because your right to life and the right to health, they are interdependent. Then we look at your functionality. Because being functional, you cannot be productive. And without having a productive community, you cannot have development. So your health impacts on your functionality, and it impacts on the total development of the community, of the country. So when we have people that are lacking in good health, there will not be development, because they will not be very productive. That is why government needs to ensure that our right to health is guaranteed, because that is when we are going to have productivity, and that is when we are going to have development. Thank you.
Thank you very much. Pharmacist Okubeni, as a professional, seasoned professional with experience in this area, you've worked within this space over the years. We're looking at how to impact communities and socioeconomic development. Our keynote speaker spoke about curriculum within the pharmacy schools. You've touched a little bit on the community-based testing. What else would you want to put forth at this time?
Okay, thank you. I think I'll talk on medication adherence. Because mental health is a chronic issue, a chronic disease, most of them naturally. I know many of us, even to take our anti-malaria for 3 days is a problem. By the time we are done with the second day. So imagine someone on the medication for life. So really, as pharmacists, we come in medication adherence. Most of those patients will want to default. So you can ask, okay, why are you not adhering? And you get things like cost. So when it comes to the issue of cost, okay, you can look for a substitute and give. Or hear things like the side effects of these medications, because some of them really have side effects that are not nice. We had a patient recently that drives, is an Uber driver, and he's on a medication, haloperidol. And one of the side effects is sedation, so he was sleeping. And of course, by the time he removed himself from the haloperidol, he found that he could drive very well. He was not sleeping again. And so when he came to the hospital and we were giving him his medication, he told us, like, Madam, I'm not going to use this medication. And by the time we probed, we found out that it was because of the side effects. So we had to talk to the doctor, give a brand that is less sedative, so that this guy can function very well, and that's what he did. So majorly, medication adherence for mental health is very important. We need to come in, hear them out why they are not using the medications, and then we're able to provide solutions. Then we also look at the medication management. Are they taking the right drugs? Are they treating the right disease? Is it the right route of administration? Some naturally will not want to take pills. So that's where things like